What happens when the chin goes back?
They don't
goes
get-
back in the airway.
They also don't get dates.
It shows up later as type 2 diabetes, heart disease, stroke.
A lot of parents out there better pay attention to this. If you got children especially, or it could be afflicting yourselves. But Dr. David McIntosh, international ear, nose, and throat specialist, leading authority on pediatric airway and sleep disordered breathing, author of multiple books, including Snored to Death, mission-driven educator, connecting breathing disorders to ADHD, developmental delays, and long-term health consequences. How do parents know if their kids are mouth breathers or doing this? Number one. Number two, big deal. What's the harm? What could happen?
Good starting point. So the first thing is that the only reason that parents would know about if their child is doing it is because they've actually seen and heard it. And that's unusual. It's really actually unusual that parents do know what's going on. And the next problem is they don't even know that they're supposed to be looking for this in the first place. So this is probably step one, is say, look, really easy. Children, they're not supposed to mouth breathe. They're not supposed to snore. Now, okay, if they've had a really big day, they're really tired, or they've just got a cold and they're a bit blocked up at the time, and it's just circumstance, that's normal. But if we're talking about a child that is doing this night after night, week after week, month after month, that's not normal. And how do you work that out? You've got to get out of your own bed and go and see what's going on in their room. You got to look and you got to listen, and you got to do it every night for a week or two. It's not a lot of time you need to do it for. You're not going to be there the whole night. Just a couple of minutes here or there. Just watch and listen. And if you spot it, write it down. Make a little diary of it. So that way you've got a record of it. And when you look back at it, you can go, oh, wow, actually, yeah, they are actually snoring or mouth breathing or both a fair bit most of the nights that, I've been checking on them. And if that's the case, that's our starting point.